Hi, this is Christy with Guidepost to Wellness. Welcome back to the channel that covers just about anything and everything that has to do with wellness, and welcome to any new subscribers that are out there. Today what I wanted to talk about is a little bit about the confusing state of literature that's out there that's based on studies, on medical studies, and how it can be really confusing because you'll see studies that'll come out that'll say one thing, and then a short while later it will be retracted. So I wanted to talk a little bit about what makes a good study, so as you're reading through the information on the mainstream media, that you can try to look at the information with a little bit more of a discerning eye. The example that I saw recently was about vitamin D and the help with the novel coronavirus. But recently I've seen another study that has come out about whether or not intermittent fasting is bad for you. And then just a few months ago, I think it was in June or so, there was a massive study that came out that was published in the Journal of American Medical Associates and what was the other one? Lancet. And it was about hydroxychloroquine and how that it was not a good drug to use, and it was published in those two wide-scale studies. Well, the hydroxychloroquine study had to be revoked because it turned out that the studies that were assumed to be correct were based on really, really bad data. The intermittent fasting studies that I've read recently were extremely small studies. And so you have the media that sometimes will grab on to a new study that comes out and throw it out there like it's gospel or it's fact. And that can be really, really confusing. And I'm sure many of you can think back to like vitamin E is good for your heart. And then a few years later, a study comes out, oh, don't take extra vitamin E, it's toxic. So that can be really confusing. So what I wanted to talk about a little bit is just some things to keep in mind whenever the studies are in the mainstream media. First of all, look at whatever you're reading in the mainstream media and look for the true source and the true study. And hopefully it's linked to in the article. If not, they should have the name of the study or some other piece of information where you can go and actually do a little bit of research yourself. The more vague the article is about the study, the more caution I would urge you to have about taking it for gospel, if that makes sense. So that's the thing when it comes to studies. I've actually taken classes in biostatistics, and I can really go down a rabbit hole about a study. But even just some of the fundamentals that I want to talk with you today are things that you can research yourself. So we don't always know why the study was undertaken, but I think that can be a very valid point. Is it undertaken to try to find a new treatment, for example, with what we have going on right now with the novel coronavirus? Are they looking for new treatments? Yes, people are frantically studying for new treatments. Is it a way to make more money? Is it a way to improve a protocol? All those things are important. The one thing I would say about all of the studies that are coming out right now is that many of them are very, very new. So any new study, you'd want to wait and see if it's been replicated and has it been peer reviewed. Those are very important things about a study. You could have a study that comes out and it just seems like it is going to be the best thing since sliced bread. But if nobody else can reproduce the exact same results, then that leads it to be that it may not be factual. It may have just been a one-off type situation. Who conducted the study? I think that obviously is one that you want to make sure that if you have a medical study that it's being conducted by medical professionals. You want to have medical doctors, or you want to have PhD pharmacologists or something of that nature so that they are skilled in that. If it is more of a social science type of study, then you want to make sure that you have psychologists or psychiatrists or sociologists that are doing this study that understand the field that they're in. I wouldn't want a psychiatrist doing a cancer study, for example. okay? This one may be sometimes hard to find, but this one is really relevant. And this one, I think a lot about food marketing. Who funded the research? And I think of food marketing, the Dairy Council, for example. If the Dairy Council funds a research, then there is a high probability of potential bias that's going to be there. And even if the scientists are attempting to do the correct things and follow the right protocols, it could be a matter of they had 5 examples of the study that didn't do well, but the 6th one did do well, and that's the one that's published because, again, it's funded by somebody that has some type of agenda. So if we can figure out who paid for it, surveys and polls and studies that are being done in the political field, who paid for those? Are they a third party, or are they somebody that is affiliated somehow with the political or social information that they're trying to ascertain? How was the data collected? And this is when you're looking at medical type of studies. You're looking for a double blind, if possible, placebo-controlled. That way nobody knows whether or not they're getting the drug, and that includes the doctors, that includes the patients. It's completely blind, so that then there's no bias, and then you can just look at the results for what they are. If the data was collected by questionnaires, then you have to look at the information in the questionnaires. Were the questions themselves biased? Was it a structured interview? Things of that nature. There are different types of samples, too, that we have to look at. And I think about this a lot with political polls, which are similar to studies, and they're looking for specific results. So, for example, when it comes to political polls, where was the polling done? Is this a high probability that you're going to get the result that you want, or is it more of a non-probability sample where you're getting a true sample of the people? And then speaking of sample size, that's really important. For any study that is less than 1,000 participants, then there's the potential that the study is not going to be able to be generalized across the board. So I think that that's important to look at the scale of the study. A lot of times medical studies may be very small numbers of people. And for example, I was looking at one about vitamin D levels and whether or not it would support COVID, how it would impact people's recovery rate and susceptibility to it. And Dr. Hollick with Boston University, one article cited that he did a study of 254 patients that were admitted. So that's not a very large sample size, and that's not necessarily a sample size that's going to tell us anything about whether or not it's protective. It's only going to tell, what was the level of the vitamin D. One of the things about this study was they looked at people that they had a vitamin D level within the last year. Well, vitamin D levels change, especially when you're looking at summer months if people are getting a little bit more sun, because vitamin D is made through the skin primarily. Looking at the skin complexion of the folks and the amount of melanin can impact how much vitamin D is made. Were they supplementing at the time or not? So all of those are really important factors. And testing somebody that had a low vitamin D within the last year really doesn't tell me a whole lot about their health at the time that they contracted the disease. So another article talked about that Dr. Hollick went back and did a cohort study, which means he goes back and looks at other studies, and he looked at 190,000 plus patients. Well, that's going to give me a little bit better of an idea, especially if it's not just patients that are in the hospital. These are folks that may have been diagnosed with COVID, and I think that would provide a much better sample. The challenge with that is when you're doing a cohort study, you're basically looking at a bunch of other studies that people have done. So if those studies aren't performed well and you're drawing conclusions from them, again, garbage in is garbage out. And sometimes you have to look at what are you researching, and are the studies that you're looking at giving you the actual data that you want to measure. And that's where you have to be careful looking at secondary data. That's where the hydroxychloroquine study, the doctors were very well known, and they were doing a cohort type of study, or actually more of an analysis of medical results from a database. So this database supposedly had information from countries all over the world, and it had a lot of information that would not be relevant in medical charts. Racial and demographic information is not generally kept in a medical chart. And that to me was immediately suspect when I read about this study. And then that's what happened, is that people were reading this study going, this doesn't make any sense. And some hospitals and the doctors at those hospitals were cited as being part of the data collection. And the doctors were like, no, we weren't. We don't collect that data. So then that immediately put the database that the scientists were using to draw their conclusions from suspect. And that is why all of the studies based on that had to be pulled and revoked from the magazines, because it was very, very bad data. So you can see there's a lot of things that we want to look at in a study, and especially whenever it comes down to something that the mainstream media is putting out. So we need to read past the headlines. We need to look and see if they actually cite the study. And granted, not everybody has the interest to go in and read the study itself. But even if you just read the abstract, which is going to tell you a lot about how many people and different things like that, if it just doesn't make sense, or it doesn't seem like it's going to be something that can be generalized across the board like the media is doing, then hold back and just wait until more information comes out, because it could be a situation where more studies are going to come out and show differing perspectives. That's why peer-reviewed studies are very important, and that's why making sure a study is actually replicated and more than one office or hospital or test group got the same types of results. All of those are really, really important. And these are things that just a basic reading of the article and reading of the medical journal synopsis and stuff can give you. You don't have to have biostatistics. You don't have to look at all of the room of reason of error and all that type of stuff. You don't have to really kind of look at a study and say, yeah, I think this might be valid, or no, it's not. The other thing to look at too is, how recent is the phenomenon? There are folks that are going back and looking at much older studies that have to do with the SARS, the swine flu, and other diseases, and how different drugs are working with that. So those are much older studies, and they're not something that's just been rushed and done very quickly in the last couple of months. So take a look at all of that information and just kind of take pause. Don't believe everything that you read in the mainstream media, and dig a little bit deeper. And then that'll help you kind of set back a little bit and go, okay, well, I don't necessarily need to go out and worry about this and take this supplement and buy that supplement, or stop intermittent fasting because this one small study says that it's bad for my heart, when there's 800 other studies that say that it has tremendous health benefits. If you are low in vitamin D, I think vitamin D, there are so many studies out there that show that it is fundamental for wellness overall. I would definitely look at talking with your healthcare provider about supplementing with vitamin D. I think that is not necessarily going to harm anyone. But to take a study and say, okay, this means I have to do that, I would step back from that, talk to your doctor if you've got any questions, and just read a little bit deeper than the headlines and look at the information and see, is this something that's sensationalized, or is this something valid? And then just kind of sit back and watch and see if it's repeatable. So don't get tied up in knots if you like intermittent fasting, and if you're doing well on it, then continue to do that. Don't take the latest few small studies that have come out and throw out the baby with the bathwater. If you are low in vitamin D, definitely take a look at that. If your doctor recommends a prescription, then think about the material on that, read up on it, talk to your doctor about the pros and cons in your situations. And again, just the mainstream media, they're not medical professionals, and They may not be giving you all the information, so make sure that you just think about the different steps. I'm going to put down some bullets down below about some of the things to think about as we're reading these studies, and to look into them a little bit deeper on whether or not we need to, run right out and buy this next supplement because it'll cure us of everything. So hope you enjoyed this segment, learned a little bit. Take care. Be well.